Could a common household pain reliever be the key to preventing heart attacks and reducing artery blockages? What is something that people don't know about aspirin and its effects on your arteries? Arteries are the highways of your body, transporting oxygen-rich blood from your heart to every tissue and organ. However, a process called atherosclerosis can hinder their vital work. Imagine plaque, a sticky substance made up of fat, cholesterol, and other substances building up inside your arteries. Over time, this plaque hardens and narrows the arterial pathways, restricting blood flow. This restricted blood flow is like rush hour traffic in your arteries. When blood flow to the heart is reduced or completely blocked, it can result in chest pain or angina or a heart attack. If this happens in the arteries supplying blood to the brain, it can cause a stroke. Factors such as high cholesterol, high blood pressure, smoking, diabetes, and a family history of heart disease can all contribute to its development. Lifestyle modifications, such as maintaining a healthy weight, engaging in regular physical activity, and adopting a heart-healthy diet, can significantly reduce your risk. Please subscribe to our channel for more informative content on health and wellness. Aspirin, a medication that's been around for over a century, is best known for its ability to relieve pain and reduce fever. But did you know that this little white pill also has remarkable effects on your blood? Aspirin's hidden talent lies in its blood-thinning properties. Aspirin belongs to a class of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs. While all NSAIDs have anti-inflammatory effects, aspirin stands out due to its unique ability to inhibit the production of thromboxane A2. Thromboxane A2 is a powerful chemical in your body that promotes the formation of blood clots. By inhibiting thromboxane A2, aspirin acts like a traffic controller in your bloodstream, preventing platelets from clumping together and forming clots. This is why low-dose aspirin therapy is often recommended by doctors for people with certain cardiovascular conditions or those who have a higher risk of developing them. Imagine your blood as a flowing river, carrying essential nutrients and oxygen throughout your body. Platelets, those tiny cell fragments we talked about earlier, are like vigilant guards patrolling this river. When they detect a breach in the riverbank, like a cut or injury, they swiftly gather at the site, sticking together to form a plug that stops the bleeding. However, in individuals with atherosclerosis, the plaque buildup in the arteries can rupture, triggering an unnecessary and potentially dangerous clotting cascade. This is where aspirin steps in as a game changer. Aspirin's unique ability to inhibit thromboxane. A2 disrupts the communication signals between platelets, making them less likely to stick together and form clots. By reducing platelet aggregation, aspirin helps maintain smooth blood flow in your arteries, even in the presence of plaque buildup. Aspirin's ability to thin the blood, preventing the formation of harmful blood clots, translates into a range of benefits for your cardiovascular health. One of the most significant benefits of aspirin is its ability to reduce the risk of heart attacks, especially in individuals who have already experienced one. By preventing clot formation, aspirin helps ensure that blood flow to the heart remains unobstructed, lowering the likelihood of another heart attack. Aspirin also plays a crucial role in reducing the risk of strokes, particularly ischemic strokes, which occur when a blood clot blocks an artery supplying blood to the brain. Beyond its protective effects against heart attacks and strokes, aspirin can also improve blood flow in people with atherosclerosis. Furthermore, aspirin's anti-inflammatory properties may contribute to its cardiovascular benefits by reducing inflammation in the arteries. Aspirin can be valuable for heart health, but it's crucial to use it safely to minimize risks. The recommended dosage for heart health is typically 81 milligrams per day. This low dose achieves the desired blood-thinning effect without increasing side effects. Taking it at the same time daily helps maintain consistent medication levels. Consistency is key in aspirin therapy. Always consult your healthcare provider before starting aspirin therapy. While aspirin offers numerous benefits for heart health, it's not suitable for everyone. People with a history of stomach ulcers or gastrointestinal bleeding should generally avoid aspirin, as it can irritate the stomach lining and increase the risk of bleeding. Individuals with allergies to aspirin or other NSAIDs should also steer clear of this medication. Those with bleeding disorders such as hemophilia or von Willebrand disease should not take aspirin, as it can further impair their blood's ability to clot. Pregnant women, especially in the third trimester, should avoid aspirin, as it can increase the risk of bleeding during childbirth and potentially harm the fetus. It's crucial to remember that this is not an exhaustive list, and other medical conditions or medications may interact with aspirin. Always consult with your doctor before starting aspirin therapy to ensure it's safe and appropriate for you. For individuals who cannot tolerate aspirin or for whom it's contraindicated, several alternatives can provide similar heart-healthy benefits. These options include other medications, lifestyle modifications, and supplements. Anticoagulants, also known as blood thinners, are medications that prevent blood clots from forming or getting larger. They work differently than aspirin but achieve a similar goal of reducing the risk of heart attacks and strokes. Examples of anticoagulants include warfarin, rivaroxaban, and apixaban. Lifestyle changes play a crucial role in preventing and managing cardiovascular disease, regardless of whether you're taking aspirin or not. Cholesterol-lowering medications such as statins can help lower your LDL, bad cholesterol levels, which is a major contributor to plaque buildup in the arteries. While aspirin offers numerous benefits for heart health, it's essential to be aware of its potential risks and side effects. One of the most common side effects of aspirin is gastrointestinal discomfort, including heartburn, indigestion, nausea, and stomach pain. These effects occur because aspirin can irritate the stomach lining. Taking aspirin with food or using enteric-coated aspirin, which dissolves in the small intestine instead of the stomach, can help minimize these issues. In some cases, aspirin can cause gastrointestinal bleeding, especially in individuals with a history of ulcers or those taking higher doses. Signs of gastrointestinal bleeding include black or tarry stools, blood in vomit, and persistent stomach pain. If you experience any of these symptoms, seek medical attention immediately. Allergic reactions to aspirin are less common but can be serious. While aspirin is generally considered safe for most people when taken as directed, it can increase the risk of bleeding, especially in individuals with bleeding disorders or those taking blood-thinning medications. Protecting your heart requires a multifaceted approach that goes beyond relying solely on medication, even one as beneficial as aspirin. While aspirin can be a valuable tool in preventing heart attacks and strokes, it's most effective when combined with other heart-healthy habits. Think of your heart health as a puzzle, with each piece representing a different aspect of a healthy lifestyle. Aspirin might be one of those pieces, but it's not the entire picture. A heart-healthy diet emphasizes fruits, vegetables, whole grains, lean proteins, and healthy fats, while limiting saturated and trans fats, cholesterol, sodium, and added sugars. Regular physical activity is vital for a healthy heart. Aim for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity aerobic exercise per week. Techniques such as meditation, yoga, deep breathing exercises, and spending time in nature can help reduce stress levels and promote overall well-being. When it comes to your heart health, knowledge is power, but it's crucial to remember that no article or online resource can replace the personalized guidance of a healthcare professional. Your doctor is your partner in navigating the complexities of heart health, providing tailored advice based on your individual needs and risk factors. If you're considering starting aspirin therapy, even low-dose aspirin, it's essential to consult with your doctor to discuss the potential benefits and risks. They can assess your individual risk factors, such as your age, family history of heart disease, lifestyle habits, and other medical conditions, to determine if aspirin is appropriate for you. Your doctor can also help you weigh the potential benefits of aspirin therapy against the potential risks, such as gastrointestinal bleeding. Remember, your doctor is your ally in maintaining optimal heart health. Their expertise, combined with your active participation in your own care, is the most effective way to protect your heart for years to come. Taking care of your heart is an ongoing journey that extends beyond medication. While aspirin can help prevent heart attacks, a holistic approach is essential. Nourish your body with a balanced diet rich in fruits, vegetables, and whole grains. Regular physical activity strengthens your heart and maintains a healthy weight. Manage stress through relaxation techniques and nurturing relationships. Quality sleep supports optimal heart function. Embrace healthy habits to create a symphony of well-being for your heart. Thank you for watching. If you found this video helpful, don't forget to like and subscribe for more tips on maintaining a healthy heart and improving your overall well-being.